Hello, welcome to my channel. Subscribe or dale like if you like. Today we are going to talk about the medicine olanzapine. We will explain its mechanism of action, its side effects, its dosage, its uses, its contraindications, its warnings, pregnancy and indications. The commercial name of olanzapine is ziprexa. Mechanism of action of olanzapine: antipsychotic, antimaniac and mood stabilizer. It has affinity for serotonin, dopamine, cholinergic muscarinic, alpha-1 adrenergic and histamine receptors. Therapeutic indications and dosage of olanzapine: adults. Oral, schizophrenia and relapse prevention in bipolar disorder, initial, 10 mg per day, manic episode, initial, 15 mg per day in monotherapy or 10 mg per day in combination treatment. Subsequent adjustment, 5 to 20 mg per day depending on clinical status. Elderly, renal failure and liver failure, initial, 5 mg per day. Intramuscular, rapid control of agitation and altered behavior in schizophrenia or manic episode, when oral treatment is not appropriate. Adults, initial, 5 to 7.5 or 10 mg, may be administered 5 to 10 mg 2 hours later depending on clinical status. Elderly, initial, 2.5 to 5 mg, may be repeated 2 hours later depending on clinical status. Maximum 3 injections in 24 hours, maximum 20 mg per day. Maximum 3 consecutive days. Kidney and liver failure, initial, 5 mg per day. As soon as possible, start oral treatment. Deep intramuscular, controlled release, maintenance treatment of schizophrenics sufficiently stabilized during acute treatment with oral olanzapine. Depending on the oral dose being received, the following doses of controlled release injections will be administered. After each injection, remain under supervision by qualified personnel in healthcare facilities for at least 1 week. Less than 3 hours to detect signs and symptoms indicative of an olanzapine overdose. Not recommended for patients over 75 years of age. Renal failure and moderate liver failure, initial recommended, 150 mg every 4 weeks. An effective and well-tolerated oral olanzapine dosing regimen has been established. Mode of administration of olanzapine: tablets, administer with or without meals. Oral tablets, with or without meals. Place in the mouth where it disperses quickly with saliva, so it is easily swallowed. Take immediately after opening the blister. Can also be dispersed, immediately before administration, in a glass of water or other suitable drink, orange or apple juice, milk, coffee. Contraindications of olanzapine: hypersensitivity to olanzapine, narrow-angle glaucoma. Olanzapine warnings and precautions: children, no experience; elderly, dyslipidemias, basal lipid control 12 weeks after starting treatment and then every 5 years, prostatic hypertrophy or paralytic ileus and related diseases, history of seizures, patients with elevated ALT and/or AST, signs and symptoms of liver dysfunction, with hepatotoxic medications or increased QTc interval, prolonged congenital QT syndrome, CHF, heart hypertrophy, hypokalemia or hypomagnesemia, patients with low white blood cell counts or neutrophils, treatment with drugs that cause neutropenia, spinal cord depression, radiation or chemotherapy, and patients with disorders associated with hypereosinophilia or myeloproliferative disease. Increased risk of tardive dyskinesia on prolonged exposure. If it appears, reduce dose or discontinue. Caution is advised when combining with other centrally acting drugs or alcohol. Not recommended for treatment of psychosis induced by dopamine agonists in Parkinson's disease, in psychosis or behavioral disorders associated with dementia, increased mortality and risk of stroke. Risk of hyperglycemia and the appearance or exacerbation of diabetes occasionally associated with ketoacidosis or coma. Measure basal blood glucose after 12 weeks of starting treatment and then annually. Control the weight of patients with diabetes or at risk of diabetes, for example basal, at 4, 8 and 12 weeks after starting treatment and then quarterly. Suspend if signs of MS, hepatitis are observed. Risk of sudden death of cardiac origin. Do not give olanzapine intramuscularly to patients with AMI, unstable angina, severe hypotension or bradycardia, sick sinus syndrome or after heart surgery. Concomitant use with parenteral benzodiazepines is not recommended. Monitor the occurrence of hypotension, bradyarrhythmia or hypoventilation in intramuscular treatment. The safety and efficacy of intramuscular olanzapine in alcohol, drug, and alcohol poisoning have not been evaluated. Liver failure with olanzapine. Consider lower initial dose, 5 milligrams. In moderate liver failure by controlled release injection, 150 milligrams every 4 weeks, an effective and well-tolerated dosage regimen of oral olanzapine has been established. In renal failure with olanzapine. Consider lower initial dose, 5 milligrams. In controlled release injection 150 milligrams every 4 weeks. An effective and well-tolerated dosing regimen of oral olanzapine has been established. Olanzapine interactions. Concentration reduced by tobacco, carbamazepine. Concentration increased by fluvoxamine or other CYP1A2 inhibitor. Oral bioavailability reduced, 50 to 60%, by active carbon. May antagonize the effects of direct and indirect dopamine agonists. Pregnancy and olanzapine. There are no adequate and well-controlled studies in pregnant women. Women should be advised to notify their physician if they are pregnant or plan to become pregnant during olanzapine treatment. However, since human experience is limited, this drug should be used in pregnancy only if the potential benefits justify the potential risk to the fetus. Newborns exposed to antipsychotics during the 3rd trimester of pregnancy are at risk for adverse reactions such as extrapyramidal symptoms and withdrawal syndromes that can vary in severity and duration after exposure. Symptoms of agitation, hypertonia, tremor, sleepiness, respiratory distress, or feeding disturbances have been reported in neonates. Therefore, newborns should be monitored closely. Breastfeeding and olanzapine. In one study of healthy women, olanzapine was excreted in breast milk during lactation. The average exposure of the infant in the steady state, mg/kg, was estimated to be 1.8% of the maternal dose of olanzapine, mg/kg. Breastfeeding should be discouraged for mothers treated with olanzapine. Effects on olanzapine driving ability. Olanzapine acts on the central nervous system and may cause drowsiness, dizziness, visual disturbances and decreased responsiveness. These effects as well as the disease itself make it advisable to be cautious when driving vehicles or operating dangerous machinery, especially until the particular sensitivity of each patient to the drug has been established. Side effects and adverse reactions of olanzapine. Eosinophilia, leukopenia, neutropenia. Weight gain and appetite, elevated glucose, triglyceride and cholesterol levels, glycosuria. Drowsiness, dyskinesia, akathisia, Parkinsonism. Orthostatic hypotension. Mild transitory anticholinergic effects. Asymptomatic and transient increases of ALT, AST. Exanthema, arthralgia. Asthenia, tiredness, edema, fever. Increased alkaline phosphatase, high levels of creatine phosphokinase, high gamma-glutamyltransferase, high uric acid, increased plasma level of prolactin. Drug reaction with eosinophilia and systemic symptoms. Intramuscular, bradycardia with or without hypotension or syncope, tachycardia, hypotension, discomfort instead of injection,